Ensure you seek permission from your subject explaining exactly where the sensors will be placed on their body. Begin by placing sensors on your subject's glute max muscles and lumbar paraspinal muscles. When applying sensors to the lumbar paraspinals, have your subject stand and flex forward slightly, as demonstrated here. Doing this will reduce signal artifacts caused by skin movement during testing. Follow our recommended muscle placement sites. Show your subject how to perform a maximal voluntary contraction of the glute max through standing glute squeeze using Mr. EMG biofeedback. Now record your subject performing 3 maximal voluntary contractions of the glute max muscles simultaneously. Ensure you take a picture of each activity so you have an image to match your data. Now show your subject how to perform a maximal voluntary contraction of the lumbar paraspinal muscles using Mr. EMG biofeedback. Record this using the Superman or prone cobra exercise. Ideally, record your subject performing 3 maximal voluntary contractions of the lumbar paraspinals. Note, if your subject is suffering lumbar pain, modify this testing protocol to suit the individual. You do not want the movement to cause additional pain. Now record the glute max and lumbar paraspinal muscle activity of your subject's natural walking gait. Compare this muscle activity during walking gait to maximal voluntary contractions to assess if any hyperactivity is present in the lumbar muscles or inactivity of the glute max muscles. If there is muscle hyperactivity or inactivity present, provide advice on postural recommendations, such as actively trying to engage their glutes at the end of their stride, asking your subject to walk again and measure if there is an improvement. Show your subject the resulting EMG data recording of recommended movement changes. Now assess glute max and lumbar paraspinal muscle activity performing the following exercises. We will start with bird dogs, followed by fire hydrants left, then right. To gain a more comprehensive understanding of your subject's glute max activity, we recommend you test them using a cross trainer or bike with resistance. Glutes do not produce much output when we walk. They are best assessed under load. We will complete our data gathering for this subject by performing 2 gym exercises as examples, starting with hip thrusts, followed by barbell squats. The exercises you test are entirely up to you, the clinician, and what you would deem most appropriate for each subject based on their symptoms. To conclude the assessment, we recommend you sit down with your subject and analyse their data, identifying any muscle hyperactivity or inactivity during movements you feel is related to their symptoms. We hope you enjoy using Mr. EMG.